The Stage 1 investment is just over $68 million. It certainly allows us to replace all our old wards, our emergency department, the operating theatres and so on, and it's going very, very well. We've had great engagement from the community, from a range of consumer groups, and stakeholders have been involved in the planning for this building. The first thing that people will notice in the new hospital here is that we have large numbers of ensuite rooms now. There's certainly some integrated security systems that will help us monitor the building and make sure we're able to keep people safe. So there's lots of innovations, I guess, here to actually help us make sure we provide the best care we can.
So we are moving into a larger footprint within the emergency department, so a larger space. And so within that, we now are able to have a designated triage nurse and area that patients, when they first walk into the emergency department, will be greeted by a clinician to enable them to have a quick assessment to determine where their journey will go. The workflow will be improved by having two very different streams within the emergency department. So we'll have an acute area, so for our emergency, resuscitation, urgent presentations, and then a fast track area, so the more low acuity but a faster turnover for our patients who present through that stream. For the community, they're walking into a brand new emergency department that has the latest technology, it's a larger footprint, so we as an emergency team can deliver high quality, safe patient care with the latest facilities and technology. The benefit of having cameras in our resuscitation bays enables us to make contact with tertiary facilities and retrieval units. Therefore, they can dial in and actually visualise the patient through the cameras, make an assessment, but also assist us with an ongoing management plan for their retrieval out of our emergency department into another facility.
Some of the key features of our new ICU that we're about to move into include the ability to do virtual assessments with our colleagues down at Campbelltown ICU. Our new negative pressure rooms will allow us to provide very specific patient care so that patients who have an infective process are able to be nursed within that confined room to protect themselves, and also it allows protection of all our other patients. The benefits of having a dedicated bariatric room are to allow patients to have up-to-date modern facilities. We now have a ceiling hoist that we are able to move our patients about their room in a very safe manner to both staff and the patient themselves. So in the designing of the new unit, we were very fortunate to be able to work with the architect and the design process, and we came up with a few, what we think are fabulous ideas. Some of them include increased visuality of our patients, so when we're in our procedure room doing procedures, we can still see through our glass windows, and the general layout will allow us to continue to monitor our patients at all times.
We've got specific spaces for our aged care population. We've also got enhanced spaces for our expectant mothers. We've also got a brand new paediatric unit that will support the types of care we provide here at Bowral, and it's very focused around family and patient.
The government has announced funding for Stage 2 in its recent budget, so another $55 million has been allocated to the Bowral District Hospital, so it's a really exciting time. Again, there's more work to be done, and we'll be doing that over the next couple of years.